What is the Russian lip technique? This procedure has gotten very popularized on Instagram and on other social media platforms. There's a lot more marketing than there is a wildly different technique. But as a general rule, each lip needs to get diagnosed as to what it needs to look its best. Some lips are very thin and they need eversion. Some lips are thicker and we're just volumizing what is already a nice shape. So as a general rule, but not exactly, not for everyone, we have two methods to inject lips. One of them is parallel to the orientation of the lip. So we're injecting like this with either a needle or a cannula. The other is to vertically inject the lip. We go from above down into the lip. Now the general advantage of vertically injecting the lip is it creates a bolus that pushes the lip out more as opposed to creating more forward volume. It lifts more and doesn't do as much projection. The Russian lip is said to want eversion and a heart-shaped lip, where the areas near the philtral columns and Cupid's bow is very augmented to push it out, and the lateral aspect is less augmented. Why are Russian lip fillers different? For me, each individual needs to get looked at as to what would make them look the best. What ends up happening, and this is where the marketing comes in, is a lot of these advertisements show these gorgeous lips, and almost any technique would look great on this lip. They've already got a C or a D- cup lip, and we're augmenting it a little and it looks awesome. It's hard to make it not look awesome. Those are the lips they tend to show. Show me the tough lips, and does the Russian lip technique do better for it? For me, if I get a very thin lip, I like to use a vertical orientation, which I don't really call the Russian lip technique. It's a more vertical orientation which will evert the lip. It will push more of the red lip out. The fillers aren't any different for this. Are they different for one technique versus the other? Not really. We're using the same hyaluronic acid product, and you as an injector or you as a patient can decide what is the best for you. I have my favorites. Many injectors have their favorites. There are a lot of good hyaluronic acids that do great things for the lip without causing lumps and bumps. How long do Russian lip fillers last? I think they last the same with both kinds of techniques. And realize that as a general rule, fillers in the lip don't last as long as they do in other parts of the face because we move our lips a lot. We smack them a lot. I'm doing mine right now. And the more we move them, the more we eat up this filler. And the second thing that makes us need filler a lot more, if I get a cosmetically aggressive patient, the kind of patient that loves the way their lips looked a day after I injected them when they're swollen, they're gonna need filler frequently to be satisfied. They may be an every 3 or 4 month filler into the lip. I would rather inject them every 3 or 4 or 4.5 months than I would over-inject their lip to make it last longer, because I don't like that look when it's over-injected to get a little more longevity. I'd rather do it more frequently. So that's what I would say about the Russian lip technique. The vertical orientation is good. The heart shape looks great on some people and not as good on other people. And that's where you need the individual consultation, what you're after and what we can achieve. That requires a consultation. And I'm very willing to do that for you. I think the consultation is everything in deciding what is best for you and what you want. And a consultation is key. Some people are more aggressive. They want a done-looking lip. And most of my patients don't want them to look done. That's how most of my patients come in. But you may be different. Come in to see me, call me, email me. Thanks.